Have you ever wondered what beer does to the penis when consumed regularly and what you should watch out for if you want to maintain your sexual health over the years? Today we are going to have a long, intimate, and practical chat for YouTube, where I will explain the acute and chronic impact of beer on erectile function and penile health, which risk factors indicate a problem, which beer styles are more damaging from a vascular and metabolic perspective, and what is a prudent guide to consumption according to age, with realistic recommendations for men in their 50s, 60s, and 70 plus. Finally, I will give you concrete steps to reduce risk and when to consult a doctor. Let's talk clearly, without judgment, focusing on useful solutions. First, the big picture. Beer contains alcohol, readily available calories, and compounds inherent to the cereal and hops. Alcohol acts on sexual function at two levels. In the short term, a single night of excess can prevent you from getting or maintaining an erection, because it depresses the central nervous system, reduces arousal, and alters the vascular response necessary for an erection. In the long term, regular and excessive consumption promotes vascular damage, metabolic disorders such as obesity and diabetes, decreased testosterone, and lifestyle changes that, together, increase the likelihood of erectile dysfunction. The relationship between alcohol and erectile dysfunction is well documented. Epidemiological evidence shows an association between habitual alcohol consumption and a higher probability of erectile problems, with nuances depending on the quantity and pattern of consumption. The second important point is to distinguish the immediate effect from the accumulated effect. If beer causes impotence on the same night, it is often a temporary effect due to intoxication. The excess overly relaxes the nervous system and reduces the necessary vascular response. This is what many call alcohol-induced erectile dysfunction, and it usually resolves when the intoxication passes and there is no chronic organic damage. But if erections gradually worsen over time and do not recover their quality between episodes of consumption, then we are talking about an accumulated effect where alcohol has contributed to vascular, hormonal, and metabolic damage that requires medical evaluation. Let's talk about mechanisms and why beer, in particular, can be influential. Chronic, excessive alcohol consumption reduces testosterone synthesis, and low testosterone translates to lower libido and reduced erectile quality in some men. Furthermore, regular consumption promotes abdominal fat gain, insulin resistance, and an altered lipid profile, all of which damage the endothelial function of the small arteries that supply the penis. There is an additional point specific to beer that often generates questions. Hops contain compounds with weak estrogenic activity, known as phytoestrogens. The hormonal effect of these compounds in men from drinking beer in normal amounts is not proven as a direct cause of feminization or loss of erections in most cases, but if beer is chronically abused and there are other factors such as obesity, liver diseases, or multiple medications, the sum of hormonal and metabolic effects can be relevant. That is, hops contribute interesting biochemical compounds, but the main driver of damage remains alcohol and associated calories. What risk factors signal that penile health may be in danger? Pay attention to sustained changes, not isolated episodes. If morning or nocturnal erections start to be frequently absent, if the hardness is clearly inferior to usual, or if you notice a sustained shortening of the erection duration, sustained loss of sexual desire, pain during erection, or the appearance of new nodules, plaques, or curvatures in the penis, these are warning signs that justify a consultation. If at the same time there is increased abdominal weight, poorly controlled diabetes, hypertension, high cholesterol, or daily and high alcohol consumption, the risk is greater. Other indicators that should prompt you to act: alcohol dependence, episodes of loss of control, driving under the influence of alcohol, falls or blackouts related to drinking, or interactions with medications you are taking. Facing any of these signs, seek evaluation from your trusted doctor and consider a urological and cardiometabolic review. Not all beers are equal in risk. From the perspective that most affects erection, there are three features that make them more problematic when consumed regularly. First, the alcohol content. Beers with a high percentage of alcohol by volume ABV provide more grams of ethanol per glass and therefore raise the toxic load more per unit ingested. Second, caloric and residual sugar density. Some very sweet craft beers, dessert stouts, and varieties with high energy density provide many calories that favor weight gain. Third, the intense concentration of hops in heavily hopped beers, such as certain heavily loaded IPAs, implies greater exposure to phytoestrogens, although the clinical effect remains small in moderate drinkers. Therefore, if you drink and want to minimize damage to the penis, the least harmful options are beers with low alcohol content and low residual sugars, light or non-alcoholic versions, and avoiding imperial or very high ABV beers consumed frequently. In addition, alcopops or sugary flavored beers with a lot of added sugar are usually worse for the metabolism. What is the recommended dose according to age? It is essential to say something clear and honest. There is no magic number that guarantees zero risk. General guidelines establish limits for adults, and many experts advise stricter limits in advanced ages due to changes in physiology. For men around 50 years old, following the general recommendation not to exceed 2 standard drinks per day as a reasonable limit reduces risks compared to abuse. For men in their 60s, the prudent recommendation is to reduce to 1 drink a day or less, and prioritize weeks with several alcohol-free days. For men 70 years old or more, many geriatricians advise limiting themselves to no more than 7 drinks per week and no more than 1 per day, and in many cases consider abstinence or specific episodes of moderate consumption given the pharmacological interactions and typical metabolic fragility of age. These suggestions call for a reduction in consumption in older people because they metabolize alcohol worse and are more susceptible to interactions. If you take chronic medication or have cardiovascular, liver, or kidney diseases, consult your doctor because the recommendation may be even more restrictive. Now, what to do if you drink beer regularly and want to protect your penile health? First, reducing the quantity and frequency is the most powerful measure. Avoid binge drinking and repeated nights of excess, and substitute some beers with non-alcoholic versions or with sparkling water and lemon. Second, control body weight and waist size. Losing weight reduces insulin resistance and improves erectile function in many men. Third, improve cardiovascular health with regular aerobic exercise, adequate control of blood pressure, blood sugar, and cholesterol. Fourth, review your medication with your doctor. Some drugs interact with alcohol, and others have adverse effects on sexual function that are amplified by drinking. Fifth, if you notice a sustained loss of erections, schedule a urological consultation. Erectile dysfunction can be an early warning sign of cardiovascular disease and deserves evaluation. Practical tips for choosing beer and drinking prudently that help erectile function. Prefer beers with low alcohol content and no added sugars. Alternate each glass with a large glass of water to reduce total intake and improve hydration. Avoid consuming beer before attempts at sexual activity if you know that alcohol affects you. Adequate recovery takes hours and sometimes a whole day if the amount was large. If you really like the taste of beer, try non-alcoholic versions to maintain the social ritual without the effect of ethanol. Maintain at least 2 or 3 alcohol-free days per week to allow for vascular and hormonal recovery. And now a final human and realistic message. Beer can be part of a pleasant social life, but like anything with the potential for excess, regular, and abundant consumption takes a toll on vascular, hormonal, and sexual health. If you are worried about your performance or the signs I mentioned, the first conversation worth having is with your primary care doctor. A simple evaluation of glucose, lipids, liver function, testosterone, and blood pressure, along with a review of your drinking pattern, usually clarifies a lot. Moderate reductions in consumption, improvements in diet, and exercise offer palpable benefits in weeks and marked benefits in months. If you wish, I can prepare a video with recipes for non-alcoholic alternatives, examples of recommendable low-alcohol beers, and a 4-week plan to reduce consumption without losing your social life. Tell me in the comments, and I will prepare it. Thank you for listening attentively and for taking care of your health with practical information and without alarmism.